There's a new report that shows when schools emphasize health to their students, they not only eat better and exercise more, but they perform better academically. Well, there you have it. Joining us this morning, Dr. Steven Sternlof, a physician with Harold Hand Oklahoma Diabetes Center. Welcome and thanks for being here.
Thank you, Allie.
All right, tell us about schools and their Healthy Lifestyles program.
There's a Schools for Healthy Lifestyles program. It's a health promotion program. It's a nonprofit, began in 1997 in partnership with the Oklahoma County Medical Society, the State Department of Education, and the State Department of Health. They currently are in 57 schools across Oklahoma. And they not only emphasize nutrition and physical activity, but they also emphasize injury prevention, tobacco use prevention, and oral health.
And you guys are the ones that did this report?
Yes, we've been working with Schools for Healthy Lifestyles for the past several years and looking at the results of their program.
I can tell you as a mom, it kind of seems like common sense. If your kids eat well, of course they perform better, but now you guys have put some research to it. Tell us about that.
Sure. One of the questions that we studied is the relationship between health and academic performance. Last year, Texas released a study that said kids that perform better on measures of cardiovascular conditioning also perform better on academic tests.
Similar.
In Oklahoma, we've been able to look at schools that have health promotion programs in place, like Schools for Healthy Lifestyles, perform better on academic performance index scores compared to schools that do not. So that's pretty exciting and pretty important.
And what do you do as a parent if you find yourself in a position where you know your children could be living a healthier lifestyle? Of course you want them to have good grades. You know they could be doing better in school. What is one to do when they say, we've got a lot of room to work for our family, but where do we go from here?
Sure. Well, the first thing is set an example. This is something that a lot of parents know. It's not always practiced. But set an example for your children. That means simple things, cutting out the soda pop, drinking more water, trying to eat more fruits and vegetables.
Sure, it doesn't make sense if mom and dad are chowing down on Oreos and then telling the kids to eat their peas at dinner at night. Make it a family thing. That's a great idea.
Sure. And then I think make food and exercise fun. Involve your kids in the grocery shopping. Involve them in meal preparation. Get outside with them to walk the dog or kick the soccer ball around. And then another important thing is to know what's going on at your child's school. Very important. Just as most parents want to know what curriculum is being taught in science or math, they should also know what's going on in physical education or athletics for their children. And they should also know what's going on in the cafeteria, what meals are being prepared and what food's being given to their kids.
That's a lot of questions, Doc. Thank you so much. If you'd like more information, you can go to oklahomadiabetescenter.com. We'll put a link on our website as well, 43thespot.com. We'll be right back.